Hello, my name is Adam Rosen. I'm an orthopedic surgeon in Southern California who specializes in knees. What I would like to share with you today is a shortened version of a previously longer lecture that I gave on knee arthritis and treatment options. What I would hope to explain to you today is a more detailed explanation of what knee arthritis is, what things you can do to treat it on your own, and to answer the question that a lot of patients may have is whether or not they need a knee replacement. A lot of patients that I talk to feel that arthritis is a buildup of something, similar to how rust would build up on an old piece of metal. Osteoarthritis is actually the opposite. It's more of a wear down, similar to a brake pad. Most commonly, knees have about 3 millimeters of cartilage, and due to wear and tear or prior injury, that cartilage can get worn down and expose the bone underneath. It's this exposed bone that can lead to abnormal rubbing and inflammation and bone spurs, all of which can lead to the symptoms of arthritis. I hear a lot of patients asked to describe their pain that they get from their knee. I try to make it a habit to ask patients more to describe their symptoms. And although some patients will describe pain as one of the symptoms of arthritis, many other patients will describe it as burning, catching, locking, swelling, or stiffness, and you may have one or more of these symptoms at any period of time. In addition to taking a history and doing a physical exam, one of the best tools that we have to assess the extent of your arthritis is to get plain weight-bearing or standing x-rays. On these x-rays, we commonly see the four common things in arthritis, which is narrowing of the joint space, osteophytes, sclerosis, or cysts. The most common thing that people are aware of is the joint space narrowing. You can see on the more normal-looking knee on your right, the space is wide open, where on the arthritic knee on the left, especially on the inside or what we call the medial side of the knee, those bones are touching, what patients refer to commonly as bone-on-bone arthritis. Contrary to what a lot of people believe, you do not need an MRI to evaluate and diagnose an arthritic knee. A plain x-ray is actually the best test for this. Although we use MRIs in younger patients when we're trying to assess whether or not they tore their ACL or their meniscus, almost all arthritic knees have meniscus tears. Over 100 years ago, Sir Morton Baker described the cyst in the back of the knee, what was termed a popliteal cyst, and what now bears his name, the Baker cyst. This is actually a swelling in the back of the knee, most commonly caused by arthritis. Removing the fluid does not tend to make the cyst go away. More commonly, it will reoccur as the underlying cause is arthritis. The most simple things that you can do at home if you do develop a Baker cyst is to use an ACE wrap or other compressive knee sleeve, ice, and anti-inflammatories if not contraindicated. If you are at home and suffering from pain or other symptoms from knee arthritis, there are a lot of treatment options. These first three are three things that you can actually do at home on your own. A low-impact exercise program is a great way to improve the function and decrease the pain of your knee. If you're like most people, you probably have a stationary bike at home that more than likely has just collected a lot of clothes that are hanging off of the handlebars. Now would be a great time to put those clothes away in the closet and start with an exercise program on the bike. I typically have my patients start riding the bike 5 minutes every other day for a week, and then each week try to increase the time on the bike to 10 minutes, 12 minutes, 15 minutes, building up slowly so you're not likely to cause increased pain or swelling. If you don't have access to a bike, or in addition to the bike, the most simple exercise that you can do is what's called a straight leg raise. This is where you lay flat on your back, bend one knee, which takes some of the pressure off your back, lock and engage the knee that's straight, and slowly lift it up only about 10 to 12 inches above the floor. Bring it back down so your heel doesn't touch, and then repeat this 10 times. You should start with doing 10 repetitions on the right, and then switch, do 10 repetitions on the left. And again, if you do this every other day for a week, the following week, try to increase your repetitions to 20 reps and then increase slowly over time. I see a lot of patients that struggle with their weight. It has been shown that in the United States, approximately 16% of people will develop arthritis in their lifetime, but if you're overweight, that risk can double. The other mistake I see a lot of people do is go on a short-term diet. Once they go on the diet and then return to their old habits, they tend to gain the weight back. So I really stress to my patients to take a look at what they eat and how they eat and try to make lifelong changes. We find that if you lose weight slowly, you're more likely to keep it off, so I try to have my patients focus on losing just 1 pound per week. If you can do this consistently for a year, that's a 52-pound weight loss at the end of the year. Most people can look at their own eating habits and determine what sort of things they need to change or adjust. Now, the other issue that I see with a lot of patients is they tend to get frustrated as they start to lose weight. They're watching what they're eating, changing their eating habits, and increasing their exercise. And then at some point, they will flatten out and hit what's called the plateau. At that point, congratulate yourself. You've done a great job. But now that you weigh less, you've become a more efficient machine, which means that you burn less calories walking around. So when you do hit that plateau, take a look at what you're doing. You may need to just increase your exercise, change your exercise, or slightly adjust what you're eating and how you're eating. Now, at the end of the day, not only will your knee pain be better, but what a lot of patients find is that their cholesterol has improved, their blood pressure issues have improved, their diabetes has improved. So these are all secondary issues that are all affected by that abnormal weight gain that you've been dealing with over the years. Now, there are a number of over-the-counter medications that you can use to treat your knee symptoms. Things such as acetaminophen, known as brand name Tylenol, can help reduce pain, and other anti-inflammatories such as ibuprofen and naproxen may also help with pain, swelling, and inflammation. You should definitely talk to your doctor first to figure out which of these medications would be safe for you to use based on other medications that you may be currently taking or other medical conditions that you have. The least amount possible to decrease symptoms is always the best. We also discussed the idea of combination therapy. We say 1 + 1 = 3. So taking the combination of one Tylenol pill with one ibuprofen pill together may work on different receptors and give you an overall better pain relief strategy than just taking one medication alone. If you continue to have pain and symptoms after failing a low-impact exercise program, weight loss, strengthening, and oral medications, there are a number of injections which may help decrease symptoms from your arthritic knee. Currently, I do not know of any clear, convincing scientific evidence that's proven that stem cell injections can reverse the effects of arthritis in an arthritic knee. There are a number of braces in the market. We typically use braces in orthopedics for patients that do have fractures or ligament ruptures. Now, in an arthritic knee, some patients do have a severe deformity, and a special brace called an offloader can unload that most arthritic side of the knee. It may decrease pain or symptoms in those patients. For everybody else, the braces may offer some symptomatic support. I hear a lot of patients describe their arthritic knee as unstable, where in actuality their ligaments are okay and intact. So by putting a brace around their knee, what they find is the knee feels warmer or more supported, or it's less likely to swell, or it gives them a sense of support. I have a number of patients that will even come into my office with a shopping bag full of a dozen braces. They have braces with a hole, without a hole, braces with straps, without straps, braces with hinges and without hinges, and none of those braces have helped them. The big question that those patients have for me is that they're afraid or fearful that not wearing the brace will make their knee worse, and that is not true. So if you haven't tried a brace, you can try a simple, inexpensive, over-the-counter brace, and if it makes your knee feel better, it's fine to use. Just understand that if you do have arthritis and you don't wear a brace, that it will not make your knee pain or your knee arthritis worse. There are a number of other things that you can use to help decrease your symptoms. The most common mistake I see a lot of patients make is they'll use the cane on the same side as their arthritic knee, when in actuality you should keep the cane on the opposite side, which helps offload that knee when you put pressure on it. There are a number of creams, patches, and ointments and salves that you can try and buy over the counter. All of these may help decrease symptoms. There's a number of other supplements and other options out there and available. What I've always told my patients is after trying the other things, if you continue to have symptoms, it's reasonable to try other things as long as it's affordable, it's not harmful, and it makes you feel better. But if you're using lots of supplements or other over-the-counter remedies, you should definitely check with your primary care doctor to make sure that none of those supplements can interact with other medications that you may be taking. Now, at the time of making this video, we're right in the midst of a pandemic, and nobody is traveling. However, once things get back to normal, In the past, I've told my patients when they travel and they have knee pain problems, there's 4 things that they should carry with them at all times. Having a Ziploc freezer bag is very helpful because a lot of times when you're traveling, you can find ice if your knee's sore, but it's difficult to find something to put that ice into. It's also useful to carry a bottle of Tylenol or acetaminophen and a bottle of your anti-inflammatory of choice. So if you do develop pain while you're on vacation or traveling, you have something to take to help minimize that pain or symptom. And the other thing which I find to be very helpful for my patients is to get and carry with them a collapsible hiking pole. This is something that you can buy at home prior to traveling and leave inside your luggage just in case you need it while you're on your vacation. One of the other questions I get commonly from patients is how they know when they are ready to have a knee replacement and what's actually involved. Although the discussion about knee replacement, the surgery risks and benefits, is outside the scope of this shorter lecture, I'm going to cover a few basic topics. I believe that prior to patients undergoing knee replacement surgery, that they should have at least tried a number of conservative things and determined that those things do not allow them to have the quality of life that they want. You also want to make sure that medically that you're safe and stable enough to have surgery. There are some people that have severe arthritis, but due to other comorbidities, the risk of surgery or anesthesia is too great. And the other important thing is that the patient have enough energy, strength, and stamina to do the postoperative rehabilitation. This is one of those surgeries where, even if everything goes well with surgery, if a patient does not do the postoperative rehabilitation, the knee will not turn out well. There are a number of total knee replacements performed every year in the United States alone, but prior to having surgery, you want to make sure that you're medically optimized. Optimizing your health helps decrease the risk of developing some postoperative complication. If you're smoking, you should quit smoking. This decreases the risk of wound complications and blood clots. Diabetics should make sure their sugars are under good control, decrease the risk of complications. Those that are overweight should work on losing weight prior to surgery, as this can also help decrease the risk of a complication following surgery. And we also want to make sure that your teeth are in good order and that your overall nutrition is healthy to help with wound healing following the surgery. It is also important to have what we call a healthy soft tissue envelope. If someone has large cuts, scrapes, abrasions, or extreme swelling around the knee called lymphedema, all of these may increase the risk of a postoperative complication, and they should be optimized with your medical team prior to having elective total knee replacement surgery performed. I hope that as we go through this pandemic, that this information has been helpful to those patients that are at home suffering with knee pain. I know that you, like a lot of our patients, have had their office visits canceled, and I hope this helps answer some of the questions that you may have had, or gives you some options for treatment options that you can do at home right now. In the meantime, everybody stay safe, stay healthy, and until next time, I'm Dr. Adam Rosen. Thanks for listening.